Hello, everyone, and welcome to another episode of the Plastic Girl Club video podcast. I'm your host, Juliet Paola, and today's episode is everything plastic surgery. I have the pleasure and the honor of sitting down with one of Miami's top board certified plastic surgeons, my longtime friend and mentor, Dr. Jason Altman, the one and only. Welcome to the Plastic Girl Club.
Thank you. Excited to be here.
I'm so honored that you took your time out of your busy schedule. I know you were busy doing surgeries to sit down and share the space with me. I'm honestly honored. And I know my listeners and the viewers are thrilled to listen to you because a lot of them follow you. A lot of them have done their procedures with you. And so this is just an awesome opportunity to talk about the great work you do.
Fantastic.
Welcome.
Thank you for having me.
So I usually start with the guests, asking them to share a little bio about themselves. I know you very well, but I want to know a little more. I want them to know more about you, how funny you are.
Hopefully that comes through. So you know who I am, Dr. Jason Altman.
The one and only.
What we call a double board certified plastic surgeon. So I have board certifications both from the American Board of Plastic Surgery. I'm also a board certified ear, nose, and throat, head and neck surgeon. So
That's right.
that'll come into play when we talk about rhinoplasty in a little bit.
Awesome. How did you get into beauty? Yeah, let's get into this.
I get asked that question by patients. I've had to answer that question through interviews, through medical school and residency. I have no idea. My mother tells me when I was 8 years old, I told her I wanted to be a plastic surgeon.
You knew it. It was in your veins already.
I had a neighbor who was a plastic surgeon. He fixed the face of one of my good friends when we were little kids. He also drove a really nice car.
Impressive.
So
you were like, I need
I
this
was like, I want to be that guy. Yeah.
Good idea.
So since the time I was 8, it's been the plan.
Nice. And you're not from Miami, right? You're
No,
originally
grew up in New York, born and raised there.
New Yorker.
That's right. Left for college, came back for medical school and residency.
You were here before all the New Yorkers got here.
I was here. I've been here for a long time. I've been here more than 15 years, and I'm just now starting to say I'm from here.
You are from here. That's it.
Up
We
until
put our
last year, it was
stamp on
I'm
you.
from New York, but I live in Miami now. I'm
But
from
I think
Miami.
it's a good mix because in New York as well, plastic surgery is a big, but Miami, I would say, is like the mecca. It's like the big local house.
It's a different. Back then. The world is becoming a more similar place, but the big difference I used to joke about when I moved here was here plastic surgery was very much accepted by everyone and was out there and in your face, right?
Everyone was doing
because it's warm and you're in bikinis all the time, but also just because we had a large Latin American population and it was
the beauty culture in Miami.
we get plastic surgery. That's part of being beautiful.
I was talking about plastic surgery at 15. I think my best friend got her first breast aug at 18, which is crazy to think that like instead of a car or like a down payment for your dorm or something, you're there like, can I please get a breast augmentation, mom? I convinced my mom. I had a horrible experience the first time before I had the pleasure of meeting you. I had my breast done, saline implants. I went to a surgery center. Horrible idea. My life was at risk. I mean, if I knew the things I know now and the things you've taught me along the way, I mean, I always tell this to my listeners and the viewers and even the girls I help on the phone when I'm speaking to them, is you have to do your research and invest in your health and your life. And the only way you can do that is with board certified plastic surgeons in a state-of-the-art facility in beautiful, sexy Miami. Just like you. Like, I mean, I don't know why I did it wrong the first time, but
it's hard.
It's important to talk about.
It's hard to be an educated consumer, especially in Florida, because for whatever the regulations are, they make it very easy for these places we call chop shops to.
No, and you really get there and you get so scared because you don't know who's operating on you. They switch up the surgeon at the last minute. A lot of patients that I've spoken to, they have no idea. So they arrive to Miami and they don't know what they just walked into, which is important to highlight people like you, surgeons that are offering these types of services at a top quality standard and that are also giving excellent results. You don't want to pay cheaper and then pay double because you have to fix it. And then nobody wants to touch you afterwards either. So
no, I charge a lot more to fix something than I do to do it right the first time.
Make note of that, everyone. Make note of that.
No, and if you're walking into surgery and you still haven't spoken to your surgeon, and it's the day of your surgery, that's a big red flag. If you're coming from out of town, maybe you had a virtual consultation or conversation, but you need to at least have spoken to your surgeon, gone over a plan, and been given reasonable expectations before you book your surgery and before you show up.
Yeah.
If you're meeting them that day, not only are they breaking the law, but it's just not the way to get safe, good results.
And I always try to educate my listeners on that. It's important to differentiate surgery centers versus state-of-the-art top surgeon procedures like yours. So, I mean, that pushes us straight into our favorite topics. Cosmetic surgery, breast implants to be exact. Like I mentioned, the first experience was not as good, saline implants. And the second experience, silicone, Sientra, Dr. Altman, hello. I needed new breast. I needed the new experience, and I loved my breasts for the time and the duration that I had them. And so, yeah, what kind of implants do you recommend? What do you offer?
Yep. So there's 3 brands of implants that are FDA approved for use here in the United States.
Okay.
Mentor,
Okay.
owned by Johnson & Johnson, Sientra, which is an independent company,
Okay.
and Natrel, which is owned by Allergan.
That's right.
Of those 3 companies, I use 2 of them.
Why?
I use Mentor and Sientra
Okay.
for a number of reasons. The first being they're the two companies that manufacture their implants here in the United
US.
States.
Oh my God, so
And
important.
they also allow me to go see those manufacturing facilities, which I've visited both of them
Fantastic.
before I use them. It's very important to me.
Yeah.
I have a direct line of communication with their directors of science and their research departments. So if I have questions or ideas, we can work through those.
That's awesome.
I just never had the same experience with the Natrel
With the other
implants.
ones.
So
No.
for my personal preference and for the safety of my patients, I find that these have optimal results and give me a full spectrum of options.
Yeah, Mentor, I've heard really great things about. And Sientra, I had the personal experience of using them myself, and they were great. So honestly, that doesn't matter to me which one, either or sounds great. But I do like how you explain why you use these versus you just ordering a pack of implants.
I'm not picking the cheapest ones out there, which
I
is
love that.
Natrel will definitely sell me implants for
I
less
know you're
money
huge on that,
than
even
these
sutures.
will.
Your sutures are like the top quality. This is important, guys. This makes a big difference when you're healing and even like the process of recovery, which a lot of people don't speak about also. They just go into like the procedure, but there's like this whole step A to Z that goes through with plastic surgery.
Every step of the way, from the minute you start the process to the end, and everything, every decision that's made in the operating room affects your outcome.
Yeah.
And any
Your
place
team
you're
has to be
cutting
in
costs
place.
or cutting corners, you're going to see that long
gonna
term
be
in your
reflected.
results. And even the cheap places and even the places we're talking about, right? It's not, they don't get it wrong all the time. They still get plenty of good results, these places.
But at what cost?
It's all what your risk tolerance is, right?
Yeah.
For me, I'm not willing to tolerate
It's not
risk,
worth it
right?
for
So
me
I need
or
to do
anybody,
everything I can to minimize risk and maximize the best outcomes. So for me, a 1% complication rate is too high.
Yeah.
Another place may accept a 10 or 15% complication rate, which still means 9 out of 10 patients are doing fine,
Yeah.
right? But a lot more of them are having problems than should be.
No, and complications afterwards. So this is just important because you're understanding the products that you're putting in the patients, and then the patients are understanding the results because you put so much thought and effort and love into what you do. It's not just, a job. This is
No,
what
and
you
it's not
love
just
to do.
It's not just financial. Like
Yeah.
at the end of the day, the patient is trusting you as the doctor to make those decisions that they're
This
not
is the way it
educated or
should be.
trained to make,
Yeah,
right?
yeah.
And so I need to make the ones that are in their best interest.
So
Between
tell me
Mentor
the
and
difference.
Sientra, yeah. So
and the projection, I know sizes, all
yeah,
of
we
that
can
plays
talk
a big
about all the
role.
details, sure. So the first question that everyone asks me when they find out I use 2 different brands, because most surgeons only use one. And the reason most surgeons use one is because the more you use, the cheaper they sell them to you
Yeah,
for.
the bigger the package.
I use enough that I can get great prices
Yeah,
from both companies, right? So the first question everyone asks when they find out I use 2 brands is, which one is better?
Yeah.
And my answer to that is, if one was better, I wouldn't be using 2
Two.
brands, right? I would only be using the better one. The right question is, which one is better for me?
Because they
And they're
differentiate.
different, right?
Yes.
So for a long time, and we'll talk about what this means in a minute, but Mentor did not offer a gummy bear implant as part of their lineup. They had silicone and they had saline, but in their silicone lineup, they didn't offer a gummy bear.
Okay.
Okay.
Well, I didn't know that.
Sientra did have a gummy bear implant on the market, and that's why I used both. I had used Mentor for a long time. I really like Sientra.
You wanted those gummy bears. That's
For
what
certain
most people ask
reasons,
for.
I need gummy bears. I don't always use them. They're not better. They're just different. And if you hand me those 2 implants there, we can actually talk about that now. There's one, and here's another. So in my left hand is a traditional silicone implant. In my right hand is a gummy bear. They're both soft.
Okay.
They're both natural. They're both durable. But the regular silicone is actually going to be a softer, more natural look and feel. So for breast augmentations, patients who want a natural look, I'm going to be going with that regular Mentor memory gel.
Nice.
Now, when I'm doing a lift, we're really using the implant to fill the upper pole.
Yeah.
And because a gummy bear, all a gummy bear is it takes what's called cohesive silicone gel and makes it highly cohesive silicone gel. So a little firmer, exact same material. But the
I
end
like when you hold
result
them up like that
is
too.
this, right? If you look at this one, you can see it gets really empty at the top.
Yeah.
If you look at this one, it holds a
Deposits.
lot more volume at the
Yes.
top. That's the gummy bear. So the advantage of the gummy bear is extra fullness at the top, when you have a lot of breast tissue, like someone with a lift,
That needs a
you
lift,
need that fullness, and it doesn't matter that it's a little stiffer because it's covered with their tissue.
Yeah, you don't just do breast augmentations. I know you do a lot of reconstructive work for breast as well, which was always really impressive to me whenever I would, see you do this for patients. But you also do breast lifts as well. And the lifts change depending on how much skin you have, how much breast tissue, right? Like the types of scars you can do.
Correct.
And I like how you educate your patients where it's not like a standard lift for everyone, because everybody is different and every single skin and everything in their body different. So you need to have a specific treatment to them. So I like how you educate them. It's not just, yeah, you need a breast augmentation, but you really need a lift. They do the breast augmentation, no lift, and a year later they're coming back for a lift because now their breasts have completely sagged. So I like how you educate them to pre-avoid all of that. That's really important. Now let's transition over to a natural look for breast implants. So a lot of people, and I know in the last 6 years this wasn't as common, explant surgeries. I know a lot of people are asking for explant surgeries. Is that like a top procedure that you're being asked, or what are some of your top procedures in breast?
So my top, from probably top to bottom, is breast augmentation is obviously the most common.
You're the GOAT. No,
that happens.
It's the truth.
I think what I'm most well known for and what people travel the most internationally and nationally for is the breast lift with implants.
I love that.
That's easily the most difficult plastic surgery procedure below the neck. It's much more complicated than just a lift or just an augmentation. Very few surgeons do it or are comfortable with it. Even less do it really well.
Correct.
I do more than probably any other surgeon in the country. I can't know that number for sure, but definitely in the top 1% in terms of how many of those we do. So I see a lot of people for that. I see even more people to fix bad lifts with implants that have been done elsewhere.
It's not even the lift, it's the scarring too. They're probably really scared about
the shape, all of it. So, and the lift scar is scary. I always joke with my patients, no one's ever come into my office and asked me for the lift scars, right? They may have asked for a lift, they may ask for a look, but no one comes in and is like, doc, what I want is a big line down the middle of my breast. But the flip side of that is, once they see their results, I've never had a patient come back and regret the scar. The results always justified if it's done right.
Also, the incision, the way you make the incision, the sutures that you use.
And I talk to my patients, right? So they know what to expect. They're not going to wake up and find a scar bigger or wider or in a different place than what we talked about.
That's so honest, and honestly makes a big difference for sure. So people that are looking to explant, like I explanted my breast, and I'm comfortable speaking about this with you through your guidance. You knew that I was going to eventually get pregnant, have my first child, and I had these big Sientra double Ds that I loved and used and abused in town. But then you said, if you want the scar, leave them on, breastfeed, have your child, or take them off, and then you don't have to worry about the scar. And so I did exactly that with you. We removed my implants, and I have amazing breasts after breastfeeding, after the fluctuation of weight, after everything post-surgery, and I couldn't be any more happier. So I want to share that with people, because if you are looking to do an explant surgery, I want them to go to you. You are the person I would recommend. A lot of complications from explants, and a lot of complications from doctors that might not know how to do that procedure as well. Because it's not as popular as implanting as explanting.
It's not as common. It's always an awkward topic to talk about as someone who puts them in. I'm never putting them in hoping we take them out.
Of course.
Right? I'm hoping we put them in and you have a lifetime of happiness from them. But situations change, lives change, weight changes, health changes, everything changes. And so sometimes people want them out, right?
Yeah.
And it's not a simple procedure. It's not as simple as just opening that,
removing
and
them,
taking
and that's
them
it.
out.
No, you have to clean the pocket, right?
You need to clean a pocket. You may need to do a lift. When I do it, I return everything to the normal anatomic situation that you had before your implant. So I reattach your muscle to where it started.
Everything was working.
Right? And if we need a lift, we do that carefully. We remove, the pocket around the implant to help with healing. So, I notice there's a lot of guys out there now that kind of push themselves as explant surgeons. I'm sure there's a few good ones out there. What I have seen is most of the guys pushing themselves as explant surgeons were having trouble finding a niche. They weren't very good at other things.
And implanting.
And so they kind of capitalize on this. They often use fear and implant safety and health to motivate people to do that surgery, which I will never do.
No, and
but you need someone, my suggestion is find someone who's very experienced with breast lifts and breast implants, they know how to put
The
them in.
anatomy
They
of
know
the
how to do
breast.
that procedure backwards and take them back out as well.
Yeah, I mean that's super important. That actually transitions us over to fat transfer to the breast, which is another cool procedure that you offer. Can you tell us about the new technique that you're working with, the new
Yeah,
items?
absolutely. So, one of the most common things among patients that do explants is they don't want their implants, but they still really like the way their breasts look,
Yeah, we
right?
still
So
want a little
they're
fullness.
kind
We
of
want a
ready to
little
get rid of the implant, but they still want some of that fullness. And they're often a little surprised when it comes out how much of their boobs were implanted.
Yeah.
They don't always remember.
Yeah.
So they're looking for a more natural way to enhance their breast.
Fat
And fat
transfer.
grafting always sounded very appealing, right? Because it's your own tissue, it's soft, it's natural. The problem was that fat grafting to the breast never really worked as well as we hoped it did. And the reason is there's a level of unpredictability, right? When I put an implant in, I know that implant is 350 cc's. All 350 cc's are
Are
going
going
to
to be there the entire
forever.
time. Yeah.
With fat, you inject the fat, and you know some of
Unpredictable.
it's going to be reabsorbed, some of it's going to die. And so you lose some of what you put in.
Yeah.
You may not lose it symmetrically. So one breast may lose more than the other.
And I can see how that can cause fear and not knowing if it's
Yeah.
going to.
And for me, who's someone who likes to tell people what to expect, to be able
and
to
be
be like,
honest, too.
it may work, it may not, was never acceptable to me. And then it can also form lumps, which can affect
Later
breast
on,
cancer screening, mammograms.
Make it a little bit of a.
And so I would, when I did fat grafting, I would tell people, be prepared to have 3 surgeries. You may not need them, but we may need to go back once or twice
But I even
to get
like that
these
you're telling
even
them
and soft. And
it's
so
not- yeah.
I tell them right off the bat. So this new device we have is actually from Sientra. It's called the Viality system. And it's a new system that helps prepare the fat. So there's lots of systems out there that are used for BBLs and other surgeries that I don't really do that just help gather the fat. But this does a lot more than that. So this filters the fat. And then they have a proprietary scientific wash that you use to wash the fat in a sterile environment. And that makes the fat much cleaner, but more importantly, it significantly improves survival.
No,
right?
that's
so now we
huge.
have predictability. Now I can say I'm going to put in 200 cc's of fat, and I'm going to keep 180 to 200 as opposed to 100 to 200, right? It's a much more narrow range. There's still some loss, but we can get that to a much more controllable degree now. So
That
this
is super
product
cool.
allows me to deliver a much more accurate fat grafting procedure for all patients, not just explant patients, but anybody.
No, that's very interesting. Yeah, because fat grafting could be obviously goes directly to BBL, which is like one of the riskiest procedures, but there's other benefits from fat grafting, like in the face as well.
It's amazing. For breast now, it's nice.
For facelift procedures as well, combination.
All facelift surgeons that I know use fat grafting as part of their facelifts. I love it in the cheeks and lower lids.
Yeah, it's also an alternative for filler, which filler is also kind of like that breast aug explant kind of feel. You like them,
but you have to keep doing them, and you do too much.
You gotta remove them. It's like a whole process. Yeah. Okay, it's not easy for us women. Okay. All right, so yeah, those are super cool topics that I wanted to talk on and kind of share with people, because a lot of people don't know that you could get breast from fat grafting as opposed to just implants.
One last thing I'll say about it though is a lot of patients ask me about doing it at the same time as the explant, and I'm not a huge fan of that. I know some people do it.
You gotta give your body some time,
You
right?
gotta heal. Imagine you've had an implant in there. There's this big empty space, right? And if you go and inject fat right away, now you're just filling that hole with fat.
You're just trying to do it all too fast. You're just take your time. Take your time.
Let things heal. Let everything close, and then you can inject the fat into the breast
and have
into a safe space. Control it. Exactly.
I love that. I absolutely love that. And I know a lot of people are looking for alternatives.
Yeah, and some things take time. Like everyone wants a one-step result. The reality is some things just work out much better when you take a little more time. 3 months or 6 months in the scope of your life to get a result you like is no big deal.
Yeah, a lot of things that I like to speak on, and when I speak to the patients I talk to or the girls that come asking me for, hey, where do I get this done? How should I do this? What do I expect? Is that they need to do the research. Make sure that they do the research, and once they have all that information, start doing a little shopping. Start finding out, feeling the doctor, their bedside manner. Your bedside manner is impeccable. You're also really funny, so you can have like a more personal feel for your surgeon, as opposed to like this random guy like I just spoke to and is just gonna do this crazy procedure on me. So
no, this isn't getting your appendix out, right? It's very
real.
personal, and you have to be able to express what you want, because every single one of my patients wants something different. And you have to be comfortable knowing that not only are you expressing what you want, but that person's hearing it and understanding it.
But expectations and reality as well. So like if I come in and I say, hey, this is my inspo pick and I need a couple treatments leading to that, you have to be honest, and I have to be realistic and accept that, and know that everybody is not always a good candidate. There's also other health things that come into play, like your BMI, right? If you're an active person, are you a smoker? You don't want to have necrosis, any of those things that come from that. So I'm sure you obviously push for pre and post care just to like let them know what your must haves or must not do are, right?
Without a doubt. I mean, you're going into surgery, you're spending your hard-earned money, you're putting your trust and life in somebody's hands. Like, do the simple things that you can do to optimize your results.
Yeah.
Right?
Yeah.
Don't smoke, take a multivitamin, eat healthy.
Work out, at least walk to the corner.
Maintain your weight, walk, right. Do all the basic things you need to be healthy are going to help you heal best from your surgery. Follow your doctor's instructions. My patients all feel great after surgery. So they all think they can do everything, right?
But you prepare them for it, too.
I talk to them ahead of time, but take your time off, ease into your recovery, let your body heal. You'll have a whole lifetime to enjoy your results if you get through those first few months.
No, absolutely. Absolutely think that that's super important to let people know, and then also have realistic expectations. So making sure that they don't come in and say, I need this, and don't get mad at the doctor. If the doctor's telling you, go back, do this way, or we should reconsider surgery if I needed an AUG, but really I need a lift, I'd rather you tell me than me have a horrible result or not feel good. Because I also know the power of plastic surgery and the effect it has on self-esteem. It's helped me improve my life, the way I see beauty and the way I see myself, the way I carry myself. So I'll always be an advocate for plastic surgery done right, done by the correct doctors, because it has a big improvement in your life, whether it's reconstructive because you were born with an abnormality in your breast, or if you're just trying to fulfill a need or a desire for your body that you've wanted to fix, because there's nothing more rewarding than getting that nose job that I'm going to get with you, and taking care of that thing that bothers you. You know, I think
It's nice
that's
to
really
look in the
important.
mirror and like what you see. Like, there's nothing wrong with that.
And without people like you, we wouldn't be able to get to those things. So that's super important. The other thing before we close off that I wanted to mention is add-on stuff that you do during surgery.
Sure.
So Body Tight and Morpheus 8. Morpheus 8 I know has great results for skin tightening and collagen production, if I'm saying that right.
Yep.
And then Body Tight does kind of the same thing. A lot of people think you have to do this aside or like in the med spa setting. No, you offer this in the OR, which is for me a win-win. I get my nose done and I also get Morpheus tightening. Right. So you offer both, right?
Morpheus is amazing. It's from the same company, InMode, that makes Body Tight. Body Tight is the invasive treatment. It's all radio frequency based, meaning it uses heat to heat tissue, cause tightening, and cause collagen production.
All the stuff I like to hear.
Yeah. So Body Tight does it from the inside out,
okay.
Which we always do in the operating room. Morpheus does it through deep microneedling from the outside
and
in.
I heard it's deeper penetration than the
like estheticians' microneedle is maybe 1 millimeter. Morpheus goes all the way up to 8 millimeters.
Wow. So,
so much deeper penetration. Don't laugh. And then,
I needed to. In the medical term,
and
guys.
Then, right. And then heat delivered at depth to cause that contraction and collagen stimulation.
And burning the fat, too.
PAs, nurse anesthetists, sometimes estheticians can do Morpheus. The difference when I do it typically is I have you asleep so I can go a little higher on the energy. I can go a little deeper.
I like that.
I can get a little bit more impact on my result. I still think it works best with 3 sessions.
Okay.
So often what I'll do is I'll do the first one asleep at as high an energy as I think is safe.
And then the other two.
Someone else in my practice or my med spa will come and do the other 2 for you, ideally about 6 to 8 weeks apart.
That's important, though, because with technology today and the way that things are being offered to us, I think it's important to be able to mix things and have add-ons for your procedures so that you're not just like under anesthesia and you're like, might as well get this done as well.
You're asleep,
I'm
you're
already here.
As long as it's safe
here.
And we have time, you might as well do a little
lipo
bit.
here. I know you do a lot of
love that procedure.
And buccal fat removal.
Yep.
You do beautiful buccal fat removals, beautiful designer rhinoplasties, which are up and coming. Another thing I wanted to highlight, you've done my personal friend, Alexia. I know you've done other influencers in town and stuff like that. But your rhinos, what really like makes me want you to do my rhino is the fact that your rhinos are very natural. So I never have seen a person that you have done their nose and been like, oh, their nose is done. I've literally had them tell me that their nose is done for me to be able to notice that. And I think that speaks volumes on the way you do things. Also, the technique that you used, I think that matters a lot. Are you being asked for rhinoplasties a lot? Is that something
I do.
That's
it's probably my
coming?
Second most popular procedure after breast. It's one of my favorites to do just because of how challenging it is. And my background with ENT allows me to focus both on the aesthetics and the look of the nose as well as the function and the breathing. And yeah, I think that's probably the New Yorker in me that's more subtle with my results. I think there's like 2 schools of thought with rhinoplasty. rhinoplasty, right? What I notice is there's some surgeons that have figured out a way to make a really nice nose, and they're really good at it, but they put that same nose on every person.
Or that like little pinch
little
right
pinch,
here.
a little flip, like
yeah.
it's a beautiful nose, and probably on 80% of those patients it works, but
Or
on
they're
20% of them it just doesn't look right, and it always looks done to me, right?
Yeah.
So my philosophy, and there's no right or wrong, it's about finding the surgeon that's going to do what you want.
You have to look for what you like.
But my philosophy is I want to take your nose and just refine your features so it fits better and creates more harmony on your face. So nothing's ever exaggerated. Nothing's ever out of place with your cheek structure and your jaw structure. It's all about more creating balance for me. And that's why each nose I do is slightly different. I use different techniques in every person.
For every single person,
and
of course.
I always tell I was like, if I do my job right, no one's going to come up to you and ask if your nose was done. They're going to ask, like, they're going to know you look great. They're going to try to figure it out, and they're going to ask if you changed your hair or lost weight.
Like on the third day, they were like, I'm ready to go to Whole Foods.
Yeah,
I'm like, what
they feel fine. Yeah, absolutely.
You barely did anything, but you did. You changed their lives.
It's a huge change. It's just not an obvious one.
Yeah. No, it's super important, rhinoplasty, especially because it's a popular designer rhinoplasties. Everyone is it's like the new BBL, I would say, or like a procedure that a lot of people are asking for. Not to just go to someone who does just breast augmentations or does body treatments.
You can't dabble in rhinoplasty.
Yeah, you have to go for the professionals. Don't play with your nose. That's your face. It'll completely change your structure. Please come see Dr. Jason Altman in his beautiful state-of-the-art office in Miami. And he's able to do all kinds of procedures. Also, mommy makeovers, which are really popular. I didn't need it, but I know a lot of women post kids, 2 or 3 kids, they want to do little snatch of their belly. They also want to take care of their breasts. So those are really important procedures that you also do that don't just focus on rhino. But I do love how your background in ENT falls into play with, that surgery that's so intricate and perfect to the T.
Thank you.
Yeah. It wasn't that bad sitting with me today and chatting, right?
I can listen to you. I've listened to you for almost 15 years now, right?
Yeah, no, and I always speak on how you pretty much opened my eyes to the beauty of plastic surgery and the value that you can get from plastic surgery. It's not just a procedure. It's not just vanity. It's not just showing my breast in a nice bikini.
It's about liking, feeling good, confidence, enjoying yourself.
Lives. You change the lives of others by making small changes, and I think that what you wake up and do every day is important. That's why having people like you share insight from your perspective is important for people to make better decisions and just to continue to find out what's in the market right now.
Great. And I'm very easily accessible for people with questions.
Yes. You're also very informative. You're like a nerd at heart.
I am a nerd at heart. And I still answer all my DMs on Instagram myself. So anyone who reaches out to me with questions are getting an answer from a doctor. Amanda, who's behind the scenes here, makes it look beautiful.
Amanda, the social media coordinator,
she's responsible for everything you see there.
Yes.
But all the communication is handled by me. So if you have questions, whether you're my patient or not.
You could get in a spot with Dr. Altman. I know you're super busy. You're probably booked until the end of the year. But if anyone is looking to do plastic surgery at the moment and is looking for a top board certified plastic surgeon, I would not send them anywhere else but to you to come directly see you, speak to your coordinator, your team. Your office is beautiful. You also have skincare products, SkinCeuticals in the office.
We have a full now that I've moved offices, we actually have 3 locations. We have my surgical location, and then we have 2 full service med spas, a larger one and one that does mostly injectables. So we're able to really take care of your aesthetic needs from surgical to non-surgical.
Perfect. Well, I'm super excited you got the chance to spend this day with me and out of your busy schedule again. If you found this episode helpful, make sure to follow us at the Plastic Girl Club Video Podcast on YouTube, Spotify, Instagram, and TikTok, and Dr. Altman at Dr.Altman. That's his IG. You can contact him directly. You can also contact his patient coordinator as well as his social media coordinator if you guys need an early appointment and just want to get in to see him. Do you have anything else you want to share with our listeners? Any insightful things you want to leave them with right before we close out?
The last thing I'd say is that this is a very international practice, so I do in-person consultations every day. It's always best, and I'm happy to see you. But I also do virtual consultations, so if you are from out of town, there is a way for us to communicate, for me to see pictures or videos, have a conversation with you. We'll still always meet in person at least 24 hours before the surgical procedure, but you don't have to be in Miami to get the process started and to book surgery.
And I think that's important because a lot of these patients coming from out of town, they're really clueless. They don't know what they're stepping into, and it can be hard to see before and afters online or on Instagram. When you don't follow like say if I go to your Instagram, I see your before and afters, then I'm going to go to Real Self. And then I'm going to go over to the American Board of Plastic Surgeons just to confirm that you are a board certified plastic surgeon. Because a lot of people might be advertising board certified and they're not.
Well, it doesn't necessarily mean they're a board certified plastic surgeon, right? There's board certified dermatologists and pediatricians doing breast augmentation.
But just to be able to verify that they are accredited and it's not just an advertisement or just to push them to come through.
Do your homework.
Yeah.
It's easy to verify all these credentials.
Contact him, his coordinator, and then all the steps will lead you to the before and after of your procedure so that you're happy with your end result, you're confident, you're more fulfilled, and you leave empowered. That's really the purpose of this conversation, was to inspire others and to leave them more empowered with cosmetic surgery.
Great.
Yes.
I hope we help.
Thank you, guys.